One of the main initiatives is that communication and difficulties with communication is one of the most distressing aspects of Alzheimer's and other types of dementia. And we realised that we developed a tool that helped other people, and we thought this may well be a tool that could be of benefit to people with dementia. At the individual level, we think we've got something that can actually help individual people with dementia express their views more easily, can help them understand other people's views a bit more easily. It helps them keep connected with their family. It helps them be involved, which is one of the government priorities about how do we involve people with dementia, help them with decision making. Also, one of the big issues for people with dementia is how do we keep them involved? How do we seek their views? Whether they're still at home, how do we involve them in decisions about accepting care? If they're in a care home, how do we make sure that the activities, for example, that they're doing, are they actually things they actually want to do? Or is it just because Tuesday afternoon you do bingo, so we do bingo? So it's a way to actually find out people's views. Another big issue is in decision making, to genuinely try to involve a person with dementia so that we're respecting their dignity. I think that's one of the huge issues, and that we try to keep them involved in their own life and in their own well-being and their own plans for as long as we possibly can. We've had lots of lovely comments from people with dementia saying, this has actually really helped me focus. This has helped me remember what I'm saying because I can see what I feel when it's visual. They've said things like, it's helped me realise what my family actually are doing for me, because one of the other parts of the tool is a way of using talking mats with the family member and the person with dementia together to see each other's point of view. I think probably my favourite one from a care home was, it's just a good thing to have a blether with somebody. And that's what's often missing. It's very hard for staff to just sit and have a blether with someone who's really lost a lot of their communication ability.
The past 20 years at Dundonald House, we've really focused on supporting people with a diagnosis of dementia and their families. So for 20 years working at a grassroots level, listening to families, listening to service users, we believed that we could design a service that was above and beyond current service provision that's available, looking at best practice examples, visiting other care homes, and taking a vision of how we believed care services could be and making that a reality. So in January of this year, we opened a new care home facility that was specifically designed to support the needs of people who had been diagnosed with dementia and their family members. Before the service opened in January, we already had quite an extensive waiting list for people to come in. That was because we've used a wider consultation in developing the service and designing it by getting feedback from service users, families and other stakeholders such as GPs, consultants and community workers. On a day-to-day basis, when you come into the care home, there's some things that you can't formally put down on paper that people on a day-to-day basis can tell you, that the atmosphere when you walk in, there's such a positive atmosphere. We have also been visited by the Mental Welfare Commission, who said we were a superb service, and the facilities and the design we had are great with the Care Commission. So all in all, it's really had a very positive impact. We would like to see really stronger joint working practices between hospital continuing care settings, working together, sharing experience and knowledge to develop and enhance services. Well, we really believe that the dementia strategy, if service providers, whether that's service providers NHS or independent, voluntary or charitable services, adopt Scotland's dementia strategy, there's absolutely no reason why Scotland shouldn't lead the way in dementia services.
So the project was to make people aware about dementia, and that people with dementia can still do things, participate. They shouldn't be socially isolated, and that they need meaningful activities to have a good quality of life. So we're trying to do quite a few things at the one time. Spread the message and provide services for our residents and tenants. We've got people doing lots of different things, you know, painting, drawing, tapestry, or music, or just coming in for a cup of tea and a blether. And that's great. And the effect that it's had on the care home residents is they're much calmer. The incidence of distressing or challenging behaviour has actually reduced in the home. And I think the fear that people had in the communities round about people with dementia is going down, and the people are popping out and in all the time, and it's worked really well.
I think long term we wanted to be able to have as normal a routine for the residents as possible, something that they used to take part in themselves, so like arts and crafts, and also to help maybe develop some underlying skills that they maybe didn't realise that they had.
There's regular activity. Our tutor who works in the craft cafe is just phenomenal, really calm, and what she does with the residents is basically give them the opportunity to try things that they've maybe never tried, or also things that they've maybe not done for a long time. So there's a lot of reminiscence work going on there as well, and also new challenges. So again, it's about using that to reduce any anxiety.